Hi everybody, I'm Dr. Mark Popenhagen. I'm a pediatric pain psychologist out at Phoenix Children's Hospital in Phoenix, Arizona. I also am part of the EB team and have always been very honored to be able to come in and speak at the debra conference, and so I'd like to also thank Deborah for having me out again this year. So today I'm going to be talking to you about anticipatory anxiety, right? We all know the phrase, but I didn't even touch you yet. So how can we combat that? How can we deal with that in an appropriate way that really helps everyone get done what needs to be done, but also uh, in a way that you can do it again tomorrow? So first, I want to start off by talking about a little bit of what anticipatory anxiety is. So here we have our blister, not being very excited about being poked. Um, but anticipatory anxiety is worry or anxiety or nervousness that occurs before an event starts. And it's in anticipation of the event because the individual remembers what happened the last time. So last time it hurt a lot, this time they're afraid it may hurt more. Unfortunately, if left untreated, anticipatory anxiety tends to get worse over time. Now, anticipatory anxiety can show up in a whole lot of different ways. Some very obvious, like screaming, crying, running away. We all know those. Definitely know about bargaining and stalling, right? Just 5 more minutes, 5 more minutes. But there may be some other things that will show up that may be a little more subtle, like headaches, rashes, nightmares, insomnia, depression. And some of those may be indicative of an anxiety disorder, or sometimes not. And sometimes they're mistaken for an anxiety disorder, uh, but they may not be. So we have our blister here that was popped, and it has uh, caused pain. And of course, pain and fear of pain can be uh, very powerful motivators, right? Uh, Anyone who has touched a hot stove will remember that they're not going to want to do that again. Um, if every time you get a blister lanced, it's exceptionally painful, um, you're not going to want to lance blisters. Similar with showers and or baths or things of like that. So the trouble with anxiety and pain is that they're so closely related that sometimes anxiety can get in the way of assessing and treating pain. Which is it? Is the person more afraid or is the person more in pain? And then the other challenge is that kids who tend to be more anxious by nature tend to have lower pain tolerances. And then if you ask them later, like days or weeks later, they'll tell you the pain was much worse than what they told you originally. Of course, then also individuals who tend to be more nervous by nature, right? They're worriers. They tend to end up having a much higher pain response to even smaller, less painful procedures or events. So when working with someone to help with anxiety and pain, it's really important that the provider really treats you as an individual and tailors the treatment plan to your interests and to your abilities. So for acute events, right, I'd like to focus more on those right now. Of course, there are issues that are acute that occur quickly without notice, right? Bumping into something, some other friction event that causes a blister. Um, but those are things that tend not to be known about ahead of time. Uh, there are a lot of chronic pain events that can occur with EB, but I don't want to focus so much on those. For more of a chronic pain treatment, even some acute pain treatment, um, I'll direct you to my other talk that I gave on pain and EB. So For acute pain events, things like dressing changes, right? Dressing changes, of course, tend to last a lot longer than other procedures. They typically occur every day. They can be very distressing, and very often they'll require coping strategies that help the individual deal with them, so they can endure that longer procedure. Blister lancing can be rather painful, as many of you know. Um, But there can also be pain that comes along with invasive procedures, such as uh, throat dilatation, surgeries, or skin grafts for those who've had those, um, and other invasive things like that. So we'll start off by talking about dressing changes. Now, of course, adequate pain control is very important. And if you look at the literature, it shows that all across the world, pain associated with dressing changes is very poorly controlled, whether it be from EB or burns or other chronic wounds that require dressing changes. Pain is often very poorly controlled. This pain and t- tends to lead to other complications. Can lead to depression, can lead to anxiety, can lead to other troubles that way. And again, the pain and anxiety tends to get worse over time, um, especially as the events take longer and longer. So as dressing changes, for some folks might take only a few minutes. Other folks it can take hours. I'm reminded of an individual that I know, and sometimes their dressing changes can take up to 4 hours at a time. And I know I've met others who sometimes go even longer. So the longer it goes on, the more pain is incurred, and then the more anxiety an individual will have each and every dressing change thereafter. So who cares? I'm a little nervous, right? What does it matter? So what? I've done this before. Who cares? Well, the more you are exposed to something that hurts or is bothersome or is troublesome to you, especially as an infant, the the worse it becomes over time. And what it actually does is it changes the brain structure. So it changes how the neurons talk to each other and how the neurons are wired. And then the baby becomes hardwired for result or hardwired for being more sensitive to pain later on in life, but also their pain response tends to be much more uh, expansive. Uh, and their tolerance is much lower. If you look a little differently, right, so look at emotional, but also you look at the wound itself, anxiety tends to delay wound healing, and it affects the entire wound healing cascade. You will see an individual uh, will have a lot more stress hormones, right, that are released during those times of anxiety, and especially these hormones are constantly in the blood if you are uh, having a lot of anxiety throughout your life. And so those stress hormones tend to be immunosuppressive. They stop healing because they are designed to help keep the rest of the body going as a reaction to this event that's going on. So all of that affects the stages of healing. Um, And even after the wound closes, full granulation can be delayed for quite some time if these uh, immunosuppressive cytokines um, are suppressed. Uh, Also, if your anxiety is controlled, scarring tends to be better. So if things are granulating properly, healing properly, they're going to scar better um, if if the anxiety is much better controlled. So what do I do about it? Right? We've got anxiety. What are we going to do about it? How do we help? How do we make it so that um, we have better wound healing? We can avoid some of these other mental health issues. having things set up ahead of time can be very helpful. So people in general tend to fear the unknown, right? A very famous president once said, we have nothing to fear but fear itself. And the unknown is very much troublesome to younger kids. Now, if we can prepare them ahead of time with even a minimum amount of information, little kids can do much better. You don't have to tell them in every gory detail what's going on, but some explanation is better than just grabbing, holding down, and poking or doing a dressing change. Now, older kids, you can reassure them. You can explain to them, this is what's going to happen. This is how we're going to do it in these steps, and this is what you're going to experience all along the way. Now, when talking with your providers, as parents, as individuals with EB, it's really important to know yourself or to know your family member, because when talking with the provider, it's very important to tell them what you want, what you need. So they may feel comfortable telling you all the details, but really you don't want to know anything. So it's really important to just tell them, this is what I want. This is what works best for my child. This is what works best for me. And if you go like this, everything will be much better. Now, there is a myth out there that people will often perpetuate that will often say, this doesn't hurt. Well, it does hurt. And if you lie to an individual and you tell them that things aren't going to hurt, they're never going to believe you again in the future. Also, if you tell them it's going to hurt, their perception of the pain tends to be less. So never lie about that. I have a thing I often will tell my patients who are uh, telling me about providers who won't listen to them and who tell them the pain doesn't hurt. I always say the provider forgot to say one word in that sentence, and the word they forgot to say is me. This won't hurt me a bit, but that's not going to do a bit of good for the person who's going through the painful thing. So knowing ahead of time this is going to hurt will actually help. There's a caveat to that that also says if you tell them it's going to hurt, then it's time to talk about some of the activities that can be done to mitigate that as we move forward. And we'll get to some of that here in a little bit. You can start off by having a non-threatening environment. So if the individual is going into an environment that is frightening, is, is, is uncomfortable, it's not child-friendly, is not age-appropriate, they're going to become much more nervous and have a bigger response and a bigger anxiety response to the thing that's going on at the time. So for children, having pictures on the walls and the ceilings, right? Painting clouds on the ceilings, and there are ceiling tiles that you can get that have pictures of balloons and other fun things on them. Having distractors that are age appropriate, right? Having a major video game system set up for a preschooler with more teenage appropriate games isn't going to work as well as perhaps a tablet or other electronic device that has a child-friendly movie or a child-friendly game. Predictability also is extremely helpful. If you know what's going to happen, how it's going to happen, in what order, knowing that for many folks, but not all, for many folks, that can be helpful in reducing the anxiety of that unknown. And if you stick to that same routine each and every time, the individual going through the procedure, such as a dressing change, can have it in their head of this is what's going to happen next. Okay, I've survived this before. I know that the dressings come off first. I then have my wounds cleaned with a bleach bath or whatever. Maybe vinegar bath, whichever, and then you move on. Okay, I dry, and then after that, and on and on and on and on. So sticking with that routine can be extremely helpful in reducing anxiety. Control. Having a sense of control dramatically reduces the amount of anxiety and fear that a person has. It also reduces the amount of pain that comes along with it. If you give a child a sense of control during a procedure, they'll interfere less. So if you give them perhaps a dressing to hold on to, or here, hand me that, reach for this, they'll interfere less with what you need to do than they would if their hands were free and they had no sense of control, didn't know what's going on. They may grab at you and end up causing themselves more damage or more hurt. Also tends to be a whole lot less bargaining if you give them some control. Now, too much control, however, ultimate control, that'll lead to stalling. The kid gets much more anxious. The parent becomes more anxious. People tend to get more angry and frustrated because of the stalling, and the entire procedure that could have been done maybe in an hour now is 2 or 3 or 4 hours longer. Everybody is more upset. Um, there's often tears at this point, and that can cause a lot more difficulties. But any coping strategy, whatever you can find that doesn't cause more damage, that gives the child a sense of mastery, gives them a sense of control, is great. So what may work for one individual may not work for another. So if you have a set of siblings who both have EB, one may want to have control by holding on to all the bandages and handing them to the parent as the dressing is being changed. Whereas the other child may have a sense of control by watching a age-appropriate show on TV. Knowing your child can really set these up for success. Of course, parents, right? We all know that having a child with any kind of chronic illness or condition can be extremely hard. Parents and caregivers tend to have a lot of anxiety and fear, right? What did I do wrong? Am I doing this right? Is there anything else I should be doing? Are we going to have enough dressings to make it through, right? May have some sense of guilt. That guilt can be really difficult and can get in the way. Guilt of, or feelings of guilt that, oh, I caused this, I gave this to my child, when we all know that there's nothing that could have been done differently. Parents and caregivers can also sometimes fall into a state of depression, and this depression can cause more anxiety and fear and other difficulties in your life. So for parents and caregivers, it's extremely important to practice good self-care. And what I say to my families is, if you're no good to you, you're no good to them. You've got to take care of yourself. So take breaks. If you need a break, take a break. Having hobbies is so important, and it's not being selfish. It's giving you time to regenerate, to recharge, to help you to feel better about you and what you're doing. Call upon your significant other. If you have one, call upon other family supports. Sure, they may not do it exactly the same way that you do it, but it'll get done, and it'll get done in a way that allows you the time to have some good self-care. And so, for some folks, it's really important that they get outside support. So maybe they get their own therapy, right? They may have time with a psychologist or a psychiatrist to help them develop some coping strategies for themselves. Calling upon your friends and family, like I said a little bit ago, these can be very helpful. Um, Very often they want to help. They often don't know how to ask to help. Sometimes they won't want to bother you, but very often they want to help, and so really calling upon them is a good idea. It's also very interesting to see that as a parent is more and more anxious, the child will become much more anxious along with them. And this is because children tend to model what they see. So if I'm watching mom freaking out, well, she's been my rock and she's been the one that I look to. If she's freaking out over this, then it must be pretty bad, so I'm going to freak out. But anxiety also has a very strong genetic link. You know, dad has anxiety, his dad has anxiety, and so on and so forth up the family line. The child may have anxiety as well. It's not a guarantee, but it does happen because anxiety is very uh, genetically linked. Now, during a procedure, parents who use coping skills for themselves and model these skills tend to be calmer, and their children tend to be calmer. And their children will then model those same or utilize those same techniques that were modeled. Now, as caregivers, this next slide is not to bash anybody, not to make anyone feel guilty, because we all say things sometimes we shouldn't say. But there are definitely some things as a caregiver to not say during something that's painful, as these things may increase anxiety. So some of these things, like it says here, super obvious, right? Threatening never really helps, right? Stop crying or give you something to cry about. Right? That's not helpful. It's not going to do anything except make the child wonder, oh goody, what's next? Criticism, it's not really anywhere near adaptive. Complaints or futility, I'm so sick of this, why do I even bother? Right? It's just going to happen again tomorrow and it just never ends, and oh my goodness. Now the child will start to worry about you, start to worry about their own future, and those kind of strategies are not helpful. Now, other things of what not to say tend to be a little more counterintuitive, right? Apologizing. We all do it. We all do it often. But apologizing tends to make a child a little more anxious, as does reassurance, right? Oh, you're going to be okay. You're going to be okay. These combined with vague commands, get ready, here it comes. Well, what does that really mean? I'm going to be okay. Well, okay, but how am I going to get there? Because right now, I'm not feeling okay. So it's also very important then to look at how you say things, because that's just as important as the words that are actually said. So watch your tone. So if you are using sarcasm heavily, even if your child knows that you tend to be a sarcastic person, saying things in a gruff way, you may be angry at the situation but not at the child. The child will take that anger as being focused on him or her rather than on the situation. And the other thing to do too is if you're trying something and it's not working, don't stick with it. Try something else. Maybe it worked yesterday, but today it's not working. That's fine. Move on to something else. Try that something else. Maybe tomorrow it'll work, but today we got to do something different. Now, one other thing that's very important is to be careful of Dr. Google, right? Dr. Google can have a lot of really wonderful and informative information, but there's also a lot that can really freak you out. And the way some of these sites are designed, it's very difficult to tell which information is good, which information is bad. So having some knowledge of what sites to look at um, can be really helpful and really important. If you're not sure, if you have this information, it's okay to talk to your doctor about it and say, hey, I found this, I'm not really sure. Is this helpful? Is this something I should be following? Um, it's also very important to look out for the internet trolls. There are a lot of them out there. It seems like this has been getting worse over the past few years. And beware. Have a thick skin. They're going to say horrible things, things that are just amazingly painful and hurtful. They don't know you. They don't want to know you. They don't care. They're doing it to be mean. The best way to deal with them is to just ignore them. Um, and the less response they get, the more they tend to fade away. So what else to do? Well, prepare, like we talked about earlier. Be honest. Humor, if your child enjoys it, if you're good at it, um, can be extremely helpful and a lot of fun. Coaching your child to use effective coping skills. Hey, let's use your skills. Which one are we going to use? Right? Maybe even having a skill box where they reach in and pull out a tab of paper, or you pull out the paper. Okay, oh, today we're going to use this skill. Right? Picking a skill that works for them, coaching them to use those skills are probably the most important things. Distraction, we'll talk about that in a little bit here. And really, sometimes it's best just to talk about anything else, right? Not talking about the dressing change, maybe using that time to talk about something fun, talk about things that bring both of you joy and happiness, talk about belly button lint. It doesn't matter. Talking about anything other than the procedure itself can help get you through. And then afterwards, really reframe what you saw, right? Talk about what went well, right? You did this great, you did that great, you did the other thing great. Crying, that's fine. There's nothing wrong with crying. You did great. You used your skills, you didn't fight, you didn't run off. This was great. Focusing on what went right instead of focusing on what went wrong is much more effective and will help with anxiety moving forward. So generally, I'd say don't even focus at all on what went wrong. So, what are we going to do now? Right? What are we going to do to treat this? Well, there's always medication, right? But most of you aren't going to be wanting to use medication every single dressing change, every single time. Now, some folks who have a diagnosed anxiety disorder may find medication that's taken on a daily basis can be really helpful, but this should be done under the direction and guidance of a physician. If you need it, great. It says use it. There can be a lot of problems though, and so we want to definitely avoid those problems. With certain pain medications, especially opiates, we have to worry about overdose. Um, we also have to worry about overuse because with many pain medications, whether they're opiates or not, if you use them for a long time, you can have rebound pain, which is worse than the original pain from in the beginning. You also have to look out for acetaminophen or Tylenol toxicity because acetaminophen tends to be in a lot of different things and um, it adds up very quickly and can cause troubles with the liver. So if you're going to use acetaminophen or any other pain medication, please do so under the direction of your physician. Aromatherapy can be wonderful. You pick the smell that works really best for you. Lavender oil is one we've all heard of. Tends to be more studied than anything else. But if you find it something else that you like, use it. Smells are extremely connected to memory. If you want to remember something, attach a smell to it. Most of us, if we think about holidays, we think of the food. And not necessarily about how it tasted, but a lot of how it smelled. And so if you think of a major holiday that maybe a favorite holiday, what is it about it that you really love? What is it that reminds you of times when you were a little kid? And usually it's the smells. One little cautionary note is if you use any aromatherapy oil or other agent, just make sure and to be very careful about putting the oil directly on the skin. Generally, you want to avoid that, especially with skin that's blistered or open. So, again, not to put it onto the skin unless directed to do so by your treatment team. Music therapy can be extremely helpful, especially uh, helpful because this can be something that is done for all ages, right? Listening to music, singing songs, writing music, um, using music while using diaphragmatic breathing, talking about the music, what was played, what was the meaning of the song. Any of these things tend to reduce muscle tension, tend to reduce anxiety, tend to reduce pain. All of these things are extremely helpful. Now, taking any therapeutic approach, whether it's the ones we've just discussed or even the ones moving forward, you can use them all mixed up together, right? You can use them individually, you can use them together, whatever works best for you. So, more skills, more techniques here. We're going to start off by talking about distraction. So this tends to be the most commonly used thing, right? So I was talking earlier about watching a video while getting a dressing change or playing on a video game system. These kind of things are great for distractions. The distraction, like I said, does need to be age appropriate, but really you can use it for kids over the age of 1 month. Um, and of course, then you can use distraction uh, for the rest of an individual's life, so deep into old age. Um, Distraction is great because if you're thinking about something else, it tends to cause a little cognitive overload, and you tend not to develop so many negative memories about the pain, especially if the distraction is something fun and very enjoyable. Distraction has also been shown to have positive effects long after a procedure is over, and um, can really help out with catastrophizing, which then leads to bargaining and leads to uh, problems with success. There are many, many distraction tools, right? I've already talked about a few, but puzzles, um, music, magic wands, those are those oil wands that have sparkles inside and glitter and such. Those are great. Um, Art supplies, mobiles, pinwheels, anything. Pretty much anything can be used as a distractor. And so, again, find what works for you and utilize it. Positive mental imagery, otherwise known as go to your happy place, right? This can be done individually, a person by themselves, or guided. So if you have a parent and child working together, maybe the parent starts off describing the image, and the child will follow along, or sometimes go back and forth, right? Oh, we're at the beach, and I see a sailboat. Oh, well, I see a palm tree. Oh, I see that palm tree too, and on and on and on moving forward. Try to find something that's pleasant, that's safe, that's comfortable. This will help improve with relaxation. Whenever possible, try to involve all five senses because the more involved that you can get the entire system, the less they're going to be focusing on the anxiety provoking event. Now, yes, it's important to focus on something that's comfortable and calm, but you can also switch it a little bit and put that on its head, and you can focus on an image of being successful in accomplishing something. Could be the event that you're going through, but it usually tends to work better, I've found, if you focus on something else. Or perhaps battling whatever's bothering you. So, quick story, I had an individual who was getting dressing changes more than once a day, and he was a huge fan of the Iron Man. And so um, he and I would fly around fighting these creatures that were the cause of his pain. And every time he destroyed one of those little creatures that was uh, causing his pain, his sensation of pain decreased. And so there were times, especially when the wound was really being addressed at the site of the wound, he would have a lot of creatures attacking, and we'd have to both attack and fight back. But as he was able to knock those down, he was able to control his pain and get through these extremely painful dressing changes. Now, virtual reality is another really interesting way of distracting because it tends to use a lot of sensory inputs and it takes attention away from what's going on in the actual world and takes you to a different world. Um, as you can see here, um, this is a child on a burn unit. This is a program that's been in use for quite some time now, and it's uh, a program in which you fly through um, a frozen wonderland, and there's uh, penguins and snowmen and all kinds of other things that you throw snowballs at. So you're paying more attention to this than to what's going on over here. Tends to be very effective with needle sticks, tends to be great that I've seen with dressing changes, and tends to be a lot more fun, so you get a lot more satisfaction out of it. This system here this is an older picture, I would imagine, um, uh, as the systems now tend to be much more compact and easier to use. They even have some that have an arm that comes off the goggles, so the goggles themselves don't necessarily have to touch the skin, and the individual doesn't have to use their hands to hold them. Virtual reality definitely gives that sense of control and mastery. You get a lot more cooperation, and the kids look forward to playing, right? And their wounds have been found to heal much more quickly. This is looking at the burn literature, but the wounds tend to heal much more quickly than by just distraction alone. Breathing exercises are a great form of distraction, but also of relaxation. There are lots and lots of different ones to choose from. This is the one that I tend to teach. So I have the person breathe in very slowly, very deeply, and gently in with your nose. And as you breathe in, just totally relax all of your abdominal muscles and allow your stomach to just kind of pooch out on its own, right? It's best if the chest doesn't move at all. That's the eventual goal. But if the chest moves a little bit, it's no big deal. But generally, we're looking for the stomach to go out as you breathe in. Once you get all the way in, you hold your breath for a count of 5. Then you blow out with your mouth very slowly, very gently, noticing your stomach falling, kind of like air being let out of a balloon. After the air is let out, you pause, hold your no breath for a count of 5, and then repeat. Generally, I tell folks to repeat 10 to 20 times, but you really can't overdo this. So the more you practice, the better you get. One other time I really encourage folks to practice is at bedtime. I just have them practice this until they fall asleep. Don't bother to count how many breaths it takes, because some nights may be better or worse than others, but just go until you're asleep. There are a lot of other breathing exercises out there that can be helpful. So things like blowing bubbles. It can be a little bit of a mess, but can be a lot of fun and very distracting. Um, Blowing out birthday candles. So for this example, you start off with maybe the person's 5, and you hold up their birthday candles, 1, 2, 3, 4, 5, and oh, blow one out. So you take a big deep breath and blow out that first candle. There it goes. Now you have here, so blow out another one. There, that one goes. Another one, another one. This one always I have found tends to be a little more challenging, so maybe 2 or 3 breaths is what it's going to take to blow that candle out. It can be a lot of fun for little ones. Marshmallow guns can be a little more fun for older kids. They do tend to be pretty messy, but you get half-inch PVC pipe with a bunch of fittings, and you stick a miniature marshmallow into the business end. You blow in here, and it's actually pretty amazing how far you can shoot those little things. Like I said, they do make a mess, so you got to make sure you find them because it's a sticky mess. Here we have a little friend of mine. This is a few years old now, but blowing on a pinwheel can be very useful. She was pretty, as you can see, pretty young at this point, and she had a, a wound here on her knee that we all needed to look at and assess. But I had her here paying attention to this pinwheel, and she was pretty excited about it, partially because she could see herself in it, and also because it was moving and spinning, and we were all excited about it. So everybody in the room was excited. I got her blowing on it, so she immediately got to see it moving. Yeah, forgive the big oaf in the background. Just pay attention to the cute kid. Um, and Here we had a very uh, Here we have a very happy customer, and we got to look at her knee, and everything was taken care of, and she was calm throughout. Progressive muscle relaxation can be helpful for some folks. Other folks, if you have contractures and such, it may be a little more difficult. But basically, what that is tightening and releasing each muscle group one at a time. Generally, I have folks start off at the toes, move their way up to the to the head, um, utilizing whichever parts they can. So make a fist with the toes, flex the ankles. Um, Again, doing as much as you can, tightening it to the point of tight as opposed to tightening it to the point of pain. Hold it for the count of 5. Notice the feeling of when it's tight. Notice the feeling of what it's like when it's relaxed. And if you ever notice into the future that feeling of tight, then you also then know how to relax it down. And you do each muscle group 3 times before moving on to the next. Biofeedback can be extremely helpful as well, and all that does is it monitors some bodily function, whether it's your breathing or your heart rate or the way electricity goes across your skin. It doesn't hurt, it just measures it through your sweat. Looks at your blood pressure, EEG, muscle tension. Any of these things can be measured, and it gives you immediate feedback. This device has lights. Other devices have a computer screen that changes. Others will have a tone, a sound that changes. Um, there are many, many different kinds and many, many different price points. So some of these can be extremely expensive. Others can be not too expensive at all. It is non-invasive, which is great. There tend to be no side effects if you're careful. Some of these things you have to be careful how they're attached to the individual. So of course, as always, we don't want to involve anything that uses tape or anything else that's sticky onto the skin. But this technique can be really helpful. Clinical hypnosis is a technique that I use very often, and all that is super focused attention where the individual tends to be more susceptible and more responsive to beneficial suggestions. It's not magic, it's not mind control. A lot of people are very nervous about it, thinking that it's mind control because of what they've seen in the movies. Um, and the only amount of mind control that it is it's the individual controlling their own mind. So really, if you look at any hypnosis, it's all self-hypnosis. Hypnosis can be really helpful with anxiety, pain, distress, all a host of other things that are done. It's very quickly can be taught. There's no interactions with medications. It immediately gives you a sense of mastery and can reduce a whole lot of pain um, by causing the individual to not be thinking about it, but the individual can also turn their pain down. You can also disassociate, which is in this situation is a good thing, and that's going completely off into some other environment where the pain is not. Hallucinations, this is the good kind, not the scary kind, but seeing things that aren't really there, right? So seeing the beach, seeing a beach ball, right? I had an individual who was having physical therapy, and the physical therapist needed to have my patient uh, put her legs onto a foam block. Well, I had the individual imagine that as a beach ball. It was not a beach ball, but she sure saw one, and we were able to complete her therapy because she was focusing on the ball and what was going out in the ocean. Um, and if any of you know Arizona, we are quite a ways away from the ocean. But she saw it and really was able to get through the entire physical therapy session without too much difficulty. So in summary, makes things worse, right? Never in the history of ever has anxiety helped a major problem. Anxiety slows down healing, increases scarring, and causes a whole lot of other problems in general. Pleasure or happiness, however, does decrease pain and it decreases anxiety. Parents and caregivers, it's so important to take care of you, right? You will maybe feel guilty as you're doing it. Try not to, please, because as you get back to your loved one, you will find that you are more refreshed, you are more able to handle things on your own, and you'll be able to get on with your day in a much better way. Also, there's lots and lots of different things that can help, and really try to use them early on. The earlier you use any of these skills that I talked about today, the better it's going to work on reducing anxiety, on pain, on distress, and everybody will be a whole lot happier. And finally, practice, practice, practice. If you don't practice these skills, most of them won't work. So the more you practice them, the better you'll feel, the quicker they will work. So for example, with the clinical hypnosis, the more you practice it, you can take it from a 20-minute thing to a few seconds, where the individual is completely in control of their pain and they're able to turn it down. So I just wanted to end with this and say thank you from sunny, very hot Arizona. As you can see, the sun itself has landed over there amongst the cacti. But thank you all, and my email is there at the bottom.